Hi, Dr. Brian Kaufman, a retired family doctor, CLL patient myself, co-founder, executive vice president, chief medical officer of the nonprofit CLL Society.
Dr. Jennifer Brown, director of the CLL Center at Dana Farber Cancer Institute and the Worthington and Margaret Collette Professor of Medicine at Harvard Medical School.
Combinations are really exciting, and there's getting a lot of data on combinations at this ASH. One of them that one of your colleagues is the lead investigator on, Dr. Matt Davids at Dana Farber, is a combination of Acalabrutinib-Venetoclax-Obinutuzumab. And there were some different data cuts and different ways of looking at that. And can you share what those findings were?
Sure. This regimen is a 3-drug regimen, which is time limited, up to 2 years of treatment. And what is particularly unique about Dr. David's study is that it enrolled a very large number of patients with our highest risk type of CLL, the 17p deleted CLL. And for that subgroup, we've normally been considering that we need to use continuous BTK inhibitor therapy. But there's been a lot of interest in whether we can potentially use multi-drug regimens to get deeper remissions and even have the option of stopping to give even those patients a break-off therapy. And so I think with what we're seeing with these data, it's very encouraging that this regimen could potentially serve in that way. The regimen overall had a 85 to 90% rate of eradicating disease using our most sensitive test, looking at so-called measurable residual disease and finding that undetectable. And even in the high-risk subgroup, it was still over 70%, which is often a criterion for us deciding that it's reasonable to stop. So that's just very exciting in terms of the potential benefit to that very high-risk subgroup of this triple drug regimen, I think.
Well, this would certainly be an important consideration because sort of, not exactly the dogma, but kind of the wisdom is if you're high risk, 17p, TP53, continuous BTK is the way to go, and otherwise you have the option of continuous BTK or then obinutuzumab, and the patients at higher risk really didn't have a limited duration option that offered quite the same response rates, but those response rates are really great. Of course, we don't know about durability of response or anything. Any thoughts about the implications of this trial or any takeaways for patients that they should know about?
Well, I do think that this means that this is a potentially reasonable option for the higher risk patients, and we are hoping that this will become an option that is approved by the FDA that patients can access because of a different trial, the Amplify trial, and so it would just add to the many options that patients have. I myself am still a little bit on the fence about, even after the 3-drug regimen, if it's okay to stop in the higher risk patients or if it's better to continue one of the drugs. And we'll be collecting more and more data on that from the trial that we have, so we'll be able to provide additional guidance on that, I think, at future meetings.
Sounds like another trial in development there, yeah.
Exactly.
Dr. Brown, thanks so much for all that you're doing. I so appreciate it.
Pleasure.